So all of that brings us to that mantra that we all keep hearing, flatten the curve. The concept that we need to implement policies and non-pharmaceutical interventions to buy time so that we don't overwhelm the healthcare system capacity and therefore are able to save lives by continuing to deliver high quality care. The other thing that we're trying to buy time for actually is to give researchers a chance to the kinds of, to develop and test actually, the kinds of tools that we need to deal with this pandemic, diagnostics, drugs, and vaccines. Another way to think about flattening the curve is that we actually want to increase the doubling time of national and localized epidemics. And hopefully this will work here. Good. This is encouraging. Yes. Let's see if we can do this. I think this is a beautiful depiction. The end point of that video would have shown you this this figure, and you can see, for example, for the United States, how the doubling rate declined from roughly a doubling rate of every 2 to 3 days to now about every 9 or 10 days for the United States. And here you see the same or an analogous set of estimates for major metro areas, with Seattle having now moved from decline to about a double time of every 2 weeks, which really gets us to the point where we start to be beginning to be able to control this epidemic right here. Again, I want to emphasize, however, that there is probably substantial underdetection of cases. So people have raised questions about the reliability of some of these estimates. But overall, I think the message is that we are beginning to see traction with some of the policy interventions in some cities and some parts of the world. So the real question, of course, is what do we do to flatten the curve and ultimately control this pandemic? One thing that I learned as an infectious disease physician and epidemiologist is that if you want to beat a virus, you actually have to think like a virus. So if I were a virus, I would most of all want to do two things. I'd want to survive as long as possible, and I'd want to reproduce as much as possible. One of the best ways to spread and both survive and reproduce is to link my spread to essential human functions. And two of the best ones are breathing and sex. This virus, of course, is a respiratory virus. And the primary transmission mode is large droplets as a result of coughing or sneezing. Second thing is to travel undercover. We do know that this virus is transmitted even in the setting of asymptomatic, minimally symptomatic, or pre-symptomatic cases. Although I have to say we don't fully understand how efficient those different types of transmission are. The third thing is if we want to, as a virus, I would want to stay as infectious as long as possible. We're still learning exactly what the infectious period is, but it's pretty clearly longer than the symptomatic period. The fourth thing is that I want to be slow to kill or severely debilitate my host, so that I could have a way to be carried to the next, to infect the next person. And with more than 80% of cases being minimally or moderately affected, I think I'm in good shape here. Finally, I want to be able to change my appearance, change my coat. And here we're still learning exactly what kind of mutation or evolution rate SARS-CoV-2 has. Which brings us to the concept of the reproductive rate, or R sub 0, of infection, the average number of new infections resulting from each index infection. The reproductive rate is the product of three factors: beta, the transmission efficiency; C, the contact or exposure rate; and D, the duration of infectiousness. So to control and ultimately end a pandemic, we need to drive R sub 0, or the reproductive rate, down to less than 1. So one way to do that is to decrease C, the contact or exposure rate. And that's what we do with social distancing, things like hand washing, masks. But if we want to be able to drop back and de-escalate from social distancing, let our contacts with other people start to increase, the other way to do that is through vaccines or treatment, which decrease beta, the transmission efficiency, or the duration of infectiousness. So finally, what do we need to do to end this pandemic and de-escalate? Probably at least 8 things. First of all, we're going to need widespread viral and serologic testing, ideally home-based, not just home-based specimen collection, but actual home-based testing, sort of like pregnancy tests. And that'll have to be linked to more extensive contact tracing, potentially even assisted by mHealth platforms or IT assisted, and there's some work beginning on that front. We're also, of course, going to need both therapeutic and prophylactic drugs and vaccines, but then we need to have the delivery systems to get those things to the people who need them, and the surveillance systems to be able to do the monitoring and evaluation to understand when we need to expand back to more social distancing for a time and then back off. We also need sustained funding for pandemic disease preparedness programs and research, something that we have never had, despite a series of pandemic outbreaks previously. And finally, we are going to need, these pandemics by definition are global. So we need ongoing global collaboration for prevention and control.